Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, my incredible and knowledgeable nurse practitioner, Rosalind Arp, and I share our combined 30 years experience to guide both men and women as they age. Listen as we dive into a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. These real-life insights are always rooted in solid scientific knowledge. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. Hair loss is a troublesome issue that affects about 80 million Americans. Both men and women struggle with various forms of hair loss. And this is not just a cosmetic issue. The biggest impact of hair loss is often the psychological and emotional effects. The change in appearance can lead to a loss of confidence and self-esteem. Feelings of loss of identity, femininity or masculinity, and attractiveness are also common. But while hair loss is common, there are now so many treatments, from self-applied meds to procedures, to help with this condition.
Yes. First, let's look at the stages of our hair growth. The growing phase is called anagen. This is when the cells in the roots of the hair are rapidly dividing and new cells push the hair out longer and longer. Hair typically grows about half an inch per month or about 6 inches per year. Growth is faster in the summer as compared to winter, likely due to increased scalp blood flow in the summer. Hair stays in the anagen phase for about 3 to 5 years. So if you never got a haircut, hair could reach 18 to 30 inches.
I think my hair used to be able to reach 18 to 30 inches when I was a teenager, but I don't know about anymore. How about you?
But yeah, actually my hair's the longest now than it was ever.
Yeah.
My
your
mom
hair-
used to my mom loves to cut my hair.
Does she like it short or she prefers it long?
I think so. She's like, it just became like a big bush when I was younger because I had such thick hair. So she would make me cut it. And
Oh,
honestly, my neck would feel so much better every time I got cut.
yeah. Well, I mean, the length of your hair is dependent on your ethnic background. So if you have Asian background like you, your hair can stay in that growing phase for as long as 7 years. So that the length of the anagen phase really determines that total length of our hair. Whereas other ethnicities, the length of the anagen phase just genetically is shorter and you just can't grow hair quite that long.
Mm-hmm.
So following anagen, your hair enters a short cycle called catagen. This is a transitional phase which signals the end of the active hair growth cycle and cuts each individual hair off from its blood supply. There's only about 3% of our hairs in catagen at any given time, and each individual hair only stays in this stage for about 10 days. Then finally, your hair enters a resting phase called telogen. These hairs are not actively growing. They're just sitting there on our head at whatever final length they have reached. 10 to 15% of our hairs are in telogen, and this usually lasts anywhere from 90 to 100 days before the hair finally falls out in the exogen cycle. Then the hair bulb is ready again to start growing new hair.
Each hair follicle goes through all of these phases independently. If they didn't, all of our hairs would fall out at once when they entered exogen. But because each hair is in a different stage, we usually should shed only about 80 to 100 hairs per day. We have patients telling us all about their many different hair loss complaints. Like sometimes they'll show us how much hair is in the sink or in the shower. And sometimes they'll show me their hairbrush as well. Sometimes it's that their hair seems to be thinning, or they may feel their part looks wider and they can see a lot of the scalp there. Sometimes it's when they brush their hair and they lose tons of hair. But for men, we hear that their hairline is receding or they're losing it on the crown of their head.
Yeah, we've both seen photos of the hair at the bottom of the shower
Mm-hmm.
or the excess hair in the hairbrush, right?
Yes. And I tell them, I'm like, it's a hard way to calculate how much hair you're losing.
Right, exactly. It's not a good objective measurement. So any type of hair loss is called alopecia. And the most common reason for hair loss is androgenic alopecia. This occurs in both men and women, and it's actually a genetic condition. You may hear this type of hair loss described as male pattern baldness or female pattern baldness. And it's amazingly common. affecting over 50 million men and 30 million women. What's happening biologically is that your natural testosterone is being converted into a product called DHT at the hair follicle. DHT shrinks the bulb of the hair and shortens that growing cycle, the anagen phase. For men, the result is the classic power alleys and the receding hairline. It can also affect, though, the top of the head and leave them with only that ring of hair around the scalp. I think that's called a friar's ring.
The horseshoe is what I've heard.
The horseshoe, yes, that's also common. And in women, it can slowly thin the hair all over their scalp or cause that widening of the part. But women typically do not get the receding hairline or the power alleys like men do.
The next most common type of hair loss is called telogen effluvium. This happens when large numbers of hair follicles all go into a resting phase at the same time. That means you seem to have a lot of hair falling out of the scalp with or without new hair growth. Luckily, telogen effluvium never leads to complete baldness, but you can feel like you're shedding many more hairs than average per day. Hair may just appear thinner all over your head, or you may notice it more, especially at your crown and temples. Telogen effluvium is typically triggered by a medical or hormonal event. The most common one you may be familiar with is childbirth. After having a baby, women can feel like they're shedding hair for months and months, and that was me. But it can also be due to a significant medical condition like a recent surgery, a hospitalization, or with starting certain medications. We've even seen it after COVID infection, or we call it COVID hair. This type of hair loss typically starts a few months after the triggered event, and it can last from 6 to 12 months. The COVID hair, I definitely have heard it many times from a lot of my patients who are hairstylists. They actually had one of my patients had a client that lost her hair so much from COVID that she had to wear a wig.
Oh, wow. That's
Yeah.
really significant. Yeah.
So
Yeah.
it's something very familiar to me because a lot of the patients who come in for hormones have been doing it for many, many years. And they're like, oh, I think I'm losing hair because of the testosterone. I asked them if they've had COVID recently, and a lot of them say yes.
Oh, right. So it overlaps.
hmm
Yeah. The good news about this type of hair loss is it is self-limiting. So if you are undergoing a hormonal change, childbirth, postpartum, sickness, once that hormonal change is over, the hair will restart to grow. But because the hair cycle can take up to 6 months to start to regrow, it doesn't seem like it's improving right away. So you're better from your COVID, but it's going to take you 6 months to start to see hair growth and probably a good year or more to restore that thicker hair. Yeah. That's when I practiced obstetrics, that was such a common complaint postpartum is that women would take a shower after having a baby and they'd have to clear the drain from the hair clog halfway through the shower. They couldn't even get through their 10-minute shower because so much hair was shedding.
Yeah. Well, I definitely will say like that was my thing too, because like I had such thick hair growing up that I was like, getting it cut was I needed that, and I needed to thin my hair out when I would go to the hairstylist. But now after my baby's like it's just not as thick anymore.
Yeah. Well, in addition to hair loss, I mean, pregnancy just changes the quality of your hair. My hair changed significantly after 2 pregnancies. It used to be really curly, and now it's kind of doesn't hold a nice curl. It's just kind of bushy if I don't style it correctly. And finally, we have alopecia areata. This type of hair loss is actually an autoimmune condition where your immune system attacks healthy hair follicles. This causes patchy baldness, like little circular areas of hair loss on the scalp, or it can happen in the beard in men. Alopecia areata can even include the eyebrows and the eyelashes. And it can begin suddenly and without warning, which is similar to many other types of autoimmune conditions. This type of hair loss can wax and wane, meaning you can have patchy areas of hair loss, and then they seem to regrow, but then you develop new patches of loss. Now, these 3 conditions are not the only causes of hair loss. You can also have hair loss from a scalp infection like ringworm, or hair loss in an area of inflammation or scarring, or hair loss because you use certain hairstyles that really pull on your hair, like if you have really tight braids, or if you happen to have a habit of twisting and tugging on your hair, which some people do. That's called traction alopecia, where you're just pulling the hair out at the follicles. So it's really important when you have hair loss to get a full evaluation to figure out what is the root cause, pun intended there.
Actually also thyroid disorders.
Yes, medical conditions like thyroid disorders, severe anemia, things like that can lead to hair
Mm-hmm.
loss. And that's part of the complete evaluation that you would need.
Mm-hmm. There's something about thyroid that affects the tip of the eyebrows.
Right.
Is it
The
good?
lateral, the outside. And
Mhm.
so severe thyroid disease, you can lose the outside portion of your eyebrow. That may be one of the signs in addition to all the other symptoms you get
Mhm.
from low thyroid.
Yeah, and my husband actually suffers from alopecia areata. He gets big patches on his beard, circular patches. And one time I remembered he had one on the back of his head that was covered by his hair, and we only realized it when he cut his hair, and we're like, oh my gosh, there's a big patch there. Yeah, and the craziest thing too, it was growing white hair, like vellus, like kind hair, but like not the black hair or
Not
dark
the
because
dark
he has
hair.
dark brown hair. Yeah, so and it does grow back and then it comes again, like so and we don't know what trigger. I think what triggered it this time around. He got sick and he has a patch right now on his chin.
Oh yeah. Yeah, I
Hmm.
mean it's like many autoimmune diseases. They flare up and you have a bout of the autoimmune condition and then it might calm down and we're not always sure what triggers those bouts of it. I mean, it doesn't make sense that your body should attack itself. That's kind of at the base cause of any autoimmune condition.
Yeah, they look like crop circles, is what I say. I'm like just
Right.
little circles.
Crop circles in the beard.
Yes. Um, well, so once we know what's causing your hair loss, we can decide if we want to treat it. Remember that your hair may naturally regrow on its own with certain conditions. If you have telogen effluvium because you had just had a baby or you're recovering from a major illness or surgery or cancer treatment, or even if you've had a significant weight loss, hair may naturally come back on its own in about 6 months. But just remember, it's only half an inch per month in that 6 months. So that's only 3 inches.
Right. It's only
Uh,
restarting at the 6 month mark. It's not
mm,
full.
yes. If you have psoriasis or ringworm on your scalp, treatment of that condition will naturally create the hair growth as well. And if you constantly wear certain hairstyles that aggressively pull the hair at the follicle, changing your hairstyle can also help to stop the damage to your hair.
I actually had that condition and I didn't realize it. But when I go to the operating room, I used to wear the cap to cover your hair, and it had a piece of elastic that went all around your hairline, like over my
Hmm.
eyebrows and down my temples. And I kept losing hair at my temples, and I couldn't figure out why. And finally, it was my hairstylist who figured out when I have my cap on and my surgical mask on, it was always rubbing and putting friction at my temples because that's right where you tie your surgical mask up.
Oh yeah.
So I had to switch to using a cloth surgical cap rather than one that had a piece of elastic that was
Hmm.
just more gentle on my hair. So it prevented the friction at my temples. So you got to look to what we do to our hair. I didn't even think of it.
You're actually the one who told me like wearing tight ponytail is going to affect my hair because I was like I would
Yes.
always wear in tight ponytails and now I'm like okay I'm buying, and so I bought the different type of elastic for it.
Right. The soft elastics. And I think actually Jojo Siwa, the little blonde girl who
Yes.
was a Disney star, and her look was that she had bright blonde hair and it was always pulled in this really severe
Tight.
ponytail with giant bows. And I know that when she would perform, little girls would all want to have the ponytail and the bows. But she has actually come out and said that she has lost significant hair from so many years of that really tight ponytail.
Oh wow.
Yeah. So girls who are in like cheerleading and other things like that, or dance, where they need a constant tight bun,
Hmm.
are putting, their hair follicle at risk because they pull it so tightly.
Well, but beyond that, the most popular topical and over-the-counter hair treatment is Minoxidil, which is marketed as Rogaine. This is a foam that you apply directly to the scalp once or twice a day, and it helps to stimulate new hair growth and prevent further hair loss. Minoxidil by itself has mild to moderate results, and many patients use it in conjunction with another hair restoration treatment. It works by opening up blood vessels at the base of the hair follicle. They've actually seen blood vessels dilate within 10 to 15 minutes of minoxidil application. It can take 6 to 12 months to see hair growth with minoxidil, and once you stop applying it, you tend to lose its benefits because the blood vessels of the hair follicle closes down again. You can have some scalp irritation or itchiness, especially for using a higher concentration. And if minoxidil drips onto your face, you can have hair growth there. So you have to be cautious about where you apply it. It also comes as an oral tablet, but this will require a doctor's prescription.
Right. But it's nice to have something over the counter if you don't want to do a big workup and you want to try to thicken your hair. It's an easy to use product.
Mhm.
And speaking of prescriptions, there are two medications FDA approved for male pattern baldness: Finasteride and Duasteride. Finasteride is Propecia. The prescription is an oral tablet, but it also comes as a foam or serum for the scalp. It blocks the conversion of your testosterone into DHT, which, remember, is damaging to the hair follicle. It can take 4 to 6 months to really start to see some improved hair growth with finasteride. But unlike minoxidil, the results can last up to a year after you stop using it. Finasteride is only FDA approved for use in men, but it can be used off-label in women. It just shouldn't be used if you think you can get pregnant, because we don't want to be blocking DHT in a developing male baby. So if you don't know the sex of your fetus, we want to make sure they get the proper testosterone and DHT. What I don't like about oral finasteride, especially in men, are the side effects. DHT is an important hormone, and blocking it can result in erectile dysfunction or problems with ejaculation and decreased libido, as well as some decreased blood pressure and dizziness. So in most men, the sexual function is reversible if they stop the medication, but there is a small subset of men that do develop irreversible side effects. So certainly, as sexual health experts, it's really hard for me to recommend something that can hit people's libido or sex drive or erectile issues.
Yeah, and I wonder if the men that are taking it are aware of those side effects as well.
Exactly. How much counseling did they get before they started it? I actually had a young male patient in his 20s who's getting some thinning hair, which is not uncommon. And his doc, the first thing that happened was they put him on Propecia. And I was just like, oh my gosh, this kid's in his young 20s. He doesn't need to be blocking his testosterone. That's when his testosterone should be maxing out and he should be feeling great. He wants all the health benefits of that. So the next drug they developed is called Duasteride. And it's a bigger molecule than finasteride, so it doesn't really work topically. It's just too large to penetrate and get into the hair follicle. It also blocks the enzyme that converts testosterone to DHT, but it's significantly more potent at inhibiting that enzyme. So you can imagine it's much more effective than finasteride at stopping hair loss. But that still means we're going to have all of the concerns for side effects like sexual dysfunction and erectile dysfunction. Even though it is more potent, finasteride tends to be the main one prescribed between these two because it's better covered by insurance. But once again, Rosalind, I have trouble prescribing either of these medications that might have a detrimental effect on someone's sex life.
Yeah, I totally agree. We don't want to be helping hair growth, but then killing sex drive somewhere else.
True.
I had a patient actually said to me, a female patient said to me, I'd rather be bald than not have sex.
It is all about what you want in life, right?
Yes, I agree. But so one of the medications that does not have those sexual side effects is something called spironolactone. Spironolactone is actually a mild diuretic because it works in the adrenal glands. But at the hair follicle, it blocks the receptor that DHT attaches to. That means even if your body is creating DHT, it cannot have a negative effect on your hair. Spironolactone has been shown to be effective in over 40% of patients who are having hair loss, but just like the other prescription medications we were discussing, women should not use spironolactone if there's a chance they can become pregnant because it can cause birth defects. We also need to be cautious about electrolyte imbalances and low blood pressure because it has that mild diuretic effect. And men should be cautious about it as well because using it long-term can cause feminizing effects.
Right. Spironolactone is probably one of the most common drugs we use because we do so much hormone replacement therapy. And very often when we're first starting some testosterone replacement therapy, one of the side effects that patients can notice is hair loss. So it's a good short term to kind of help block that DHT effect at the hair loss as the testosterone is getting to its optimal level. And patients generally have some pretty good results with that.
And also great for acne as well.
Yes, that's probably the number 2 side effect, temporary side effect we see with testosterone therapy. So spironolactone's kind of one of those really neat medications that blocks the DHT where we don't want it at the hair follicle and the acne follicle, but doesn't block it systemically where we do want it. So this is why we like to recommend things that work directly at the hair follicle without having systemic or whole body side effects. PRP, or platelet-rich plasma, has been shown to be safe and effective to treat hair loss. With PRP, we're using the natural growth factors that are found in the platelets of your blood. We draw up some of your blood and spin it down to concentrate the platelet layer, and then we siphon that off. we can re-inject that platelet layer into places where we want to see hair growth. PRP needs to be injected into the scalp so it can reach the hair bulb, but it takes many injections because we have to cover a large area with the PRP, and the injections can be uncomfortable. Whereas healthy, non-smoking patients are going to have healthy platelets and growth factors, patients with chronic medical conditions, or who smoke or are overweight, are going to have less healthy platelets and less healthy growth factors. So the PRP is only as good as the platelets that are in it. To try to overcome that problem, we sometimes use exosomes. Exosomes are actually a really exciting new area in regenerative medicine. These are tiny little sacs released from cells containing RNA, protein, and other products. At one point, researchers thought exosomes were just a form of cellular waste, like a way for cells to get rid of the stuff that they didn't need. But now they realize that these tiny sacs released from every single cell are actually a way for cells to communicate and talk to each other. What's really exciting in the field of exosomes is that researchers can isolate exosomes that are meant to talk to specific organs, like just exosomes that are talking to the brain or to the thyroid. They can then load those exosomes with drugs that are meant to be delivered to that target organ. When we're talking about hair loss, we recommend an application of plant-based exosomes. These exosomes have all the concentrated growth factors and products that hair follicles need to increase their growth. By using these plant-based exosomes, we don't have to rely on the health of the body's platelets. So we know we're giving a concentrated dose every single time, so you're getting the best amount of growth factors with every application. But we're not worried about any negative side effects or side effects in an organ that is not your hair follicle.
That's really exciting research about the exosomes, not just for the hair loss, but for drug applications everywhere.
Yeah, I love that. I love that it can be specifically targeted. You may have heard that our current drugs don't treat disease. They just trade one symptom for other symptoms, right?
Mm-hmm.
So if you have, and of course, if you have side effects from a drug, that's absolutely true. But exosomes have the possibility to truly target disease without creating an additional group of symptoms. And I think a perfect example of that is corticosteroids. Steroids can be these amazing life-saving drugs, but they can also be life-crushing drugs if you have to take them chronically due to their long and worrisome list of side effects.
Yeah, that's absolutely true. We've seen that so many times.
Oh, yeah. And if you know anyone who's taking chronic steroids, their face gets bloated, they gain weight, they're retaining water, you can get that buffalo hump in your back over many years. And it's hard to reverse those symptoms, even though you know you need to take the steroid to stop whatever disease you have. If your cause of hair loss is alopecia areata, that's the autoimmune condition, injections of steroids into the scalp every 4 to 6 weeks can be extremely helpful. About 80% of patients have hair regrowth within about 3 months. So, as I said, the short-term side effects of steroids can be fluid retention in your legs, high blood pressure, changes in your mood, and weight gain.
Mm-hmm.
But long-term steroids can lead to glaucoma and cataracts, that rounded face, we sometimes call that a moon face, and an elevated risk of blood sugar and diabetes, not to mention a decreased risk of infections, thinning of your bones and osteoporosis, and thinning skin and easy bruising. So short-term steroids, great effects. Long-term steroids, really challenging.
Yes.
So we need to find the balance between positive effects of a drug and how it can be hurting us on the other side of the coin. So I'm really hopeful that maybe exosomes will fill that gap.
No, I agree. There's so much side effects with steroids. We have a lot of patients. I've had a couple of patients who've been on steroids, and luckily there are more studies or more medications coming out for a lot of the autoimmune disorders. That is taking over what steroids was taking over steroids now. It's not the first line treatment anymore.
Right. Offering non-steroid options so they don't have to deal with these long-term effects.
Mm-hmm.
So you can see how adding one medicine and then getting all these side effects, if you're on long-term steroids, but then we have to add more meds to treat your osteoporosis and add more meds to treat your diabetes, and the list just starts to snowball.
Doing weight loss programs, having our weight loss program in our office and having patients who are on steroids or when they have to do short-term steroids, it's also quite detrimental for their weight loss program when they have to do like a month of steroids and they come back and I'm like, I've gained 15 pounds and they just feel so defeated about it.
Right. Especially if they've been working so hard on their weight loss
Mhm.
journey to really do well with their weight.
Mhm. So I really try to avoid it as much as I can.
Hmm.
But if patients are interested in non-medication treatment for hair loss, we also have procedures that can really help in our office. Laser therapy, sometimes called low-level laser therapy, uses low-intensity light to stimulate hair growth. We use wavelength in the red to infrared spectrum, and this stimulates hairs to re-enter telogen, the resting phase, and prolongs the duration of anagen, the growing phase. It also increases scalp blood flow, which increases the growth of hairs in the anagen phase. Treatment is painless and has virtually no side effects, and low-level laser therapy seems to work best with androgenic alopecia for hereditary hair loss and may be helpful with telogen effluvium. It's also combined with other therapies, specifically after hair transplant. Treatments can take 15 to 20 minutes, and it works best when you have several treatments a week over 6 months.
I know they have lots of over-the-counter products you can buy, like red laser caps and
Hmm.
things. And I think as long as you're getting the correct wavelength in this particular therapy, it really is about how much time you spend under the red light. So more time is beneficial. And I love the history of medical discoveries. Low level laser therapy was accidentally discovered in the 1960s. They were radiating lab mice with the same wavelengths, these low level red and infrared wavelengths,
Hmm.
to investigate other treatments. The reason they chose these wavelengths is that they're too low to cause thermolysis or tissue damage, but enough to stimulate circulation and cell change. So they shave the mice on their belly and their back so they can see any skin changes from the radiation. When those mice were irradiated with red wavelengths or infrared wavelengths, they realized that the hair was growing back in the shaved areas. So then that spurred them to do further investigation on the intentional use of these wavelengths to regrow hair.
I know so many sorts of testing treatment for one condition, but then we end up using it for something totally different.
Right.
Or in the case of microneedling, having a successful treatment in one area and then expanding that treatment to other areas as well.
Oh, yeah. Once something works well, we want to use it all over the body.
Yes. Microneedling has been around for years, and it's using a device containing hundreds of tiny needles to create controlled injuries in the skin. And depending on the depth of those needles, we can stimulate collagen and elastin to grow. We can also stimulate new blood flow, and we can stimulate hair growth. Microneedling works by releasing growth factors and stem cells around the hair follicles and activating our natural wound healing mechanism. Plus, the needles can create channels to enhance any topical products applied. But in one study, men between the ages of 20 and 35 years old who had mild to moderate hereditary hair loss were treated with either minoxidil alone or minoxidil plus weekly microneedling. After 12 weeks of treatment, the parents treated with minoxidil and microneedling had significantly more hair growth. And then other studies have shown that using microneedling along with PRP or steroid injections also enhanced hair growth.
Yeah, the combination therapies really work great. Even though each therapy individually is stimulatory to the hair, combining things, microneedling plus PRP, minoxidil plus something, it's always,
Hmm.
you're going to see a better result.
And microneedling is like aerating the soil, as we talked about before, and like using the medication or the PRP or exosomes is more like the fertilizer for the hair.
Right. So obviously it makes sense they work together.
Hmm.
And finally, there's hair transplant surgery. This can be extremely effective, but obviously is the most invasive. Sometimes your surgeon will take small punch biopsies from areas of the scalp that still have hair and insert them into small slits in the areas where you're losing hair. Those punch biopsies then become a source of new hair growth. Other times, the surgeon may create a flap. That's where you dissect under an area that contains hair, but leave it attached to the scalp and kind of stretch it over the balding area. The blood flow in the hair follicles from the flap can then help to restore hair in the area that doesn't contain as many hair follicles. New hair starts to grow at about 3 months out, and it grows at a normal rate. By 6 months, your hair will have a more natural appearance. As mentioned before, sometimes hair transplant surgery is once again combined with low level laser light therapy or PRP injections to really enhance the growth of those new hair follicles.
But no matter what you're doing for your hair, you should really look into the basics of staying healthy, having a great multivitamin that has biotin in it. Also, it should have zinc and copper as well, that because that also helps with hair growth. You also want to make sure that to get your blood work regularly and make sure that you're not anemic or not have any thyroid dysfunction as well, because many systemic diseases can affect your hair as well.
Exactly. It all starts with the basics. So if you're a man or a woman struggling with thinning hair or areas of hair loss, just know that there are so many options available to you to combat this, and we're here to help.
Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.